Here we go. This is Vlad for RareFoundation.com, and we are speaking with
Leah Malusis.
And you are the human rights lawyer that just spoke at this gathering today, Farwell McGill, February
27th. Yeah, if I'm getting my date right.
So I need to ask you, thank you first of all for your story. It was beautiful and it was appreciated.
Thank you.
So a couple of quick questions. In a way, could you almost summarize your story and the story of so many others, that the government has taken the ability for itself to kill people for what is arguably a phase that young people almost all young people go through? Is that reasonable to say?
I don't know that I would say that all young people go through this, but what I would say is that the vast majority of people, face a moment in their lives where they despair, right? Where they feel as though there's not hope. And for many people, that becomes, and they actually get diagnosed, and that turns out to be a mental health issue. For some people, it's just a moment of acute suffering. It's not a chronic issue, but it's acute. And I would say, regardless of the reason, the real question is, what message do we send someone when they're in that place? When there are, young people, and the statistics show that many young people go through this issue. There are thousands of people who kill themselves every year. The vast majority of those people have a diagnosed mental health issue. With the pandemic, there was even more isolation and loneliness. Even if you look at the statistics about why people choose medical assistance and die or inpatient assistance suicide, many people cite isolation and loneliness. They cite loss of dignity. They cite existential suffering. And so the reality is that even though this was forward as ending people's suffering, really what is taking place is it's not about ending physical pain. It's really ending the loneliness and isolation that people feel. And I think we have to kind of grapple with this question about what message do we give someone when they're in that space. When I was in that space, I didn't need someone to come alongside me and agree with depression. I didn't need someone to come alongside me and say, yeah, absolutely, I'll help you take your own life. I didn't need someone to tell me that I could go, I could leave. I needed someone to tell me to stay. And I needed someone to tell me that my life still had meaning and purpose and value. I might have not believed you at the time, but having that message would have been undermining the lies and the cognitive dissonance that I was believing.
I use the card, yeah. I wouldn't worry about it. I got tons in the office.
That's really what matters. I've said sometimes
we had big orders at first, so I only nearly 3,000. And then it went through part of it so quick.
Assisted suicide to those with mental health issues. Is they're coming to people like me, and they're joining forces with depression. They're joining forces with mental illness, and launching an assault on my continuing this time in my life. And while they think of it as choice, while they think of it as autonomy, and I very much loved those ideas when I was 16. I thought, absolutely, I didn't sign up for this. I should get to opt out. The reality is that my choices were compromised. My ability to think clearly about my future was compromised by nature of my mental health issue. And so it wasn't until years later, now 12 years later, that I realized that my future wasn't one full of pain and suffering. There has been pain, there has been suffering, but it wasn't going to last forever. And that's one of the lies that depression tells, right? That this will be your life for the rest of your life. And so it's deeply troubling to see society come alongside and agree with the messages that mental health issues tell people who are struggling. Instead, we really need to be putting forward a message of life, of meaning and purpose. And when someone asks these existential questions, when they say, I don't feel like I have any dignity, we say your dignity and your value is inherent to you. We say.
So now on a legal question, I thought the definition of mental illness meant you aren't able to give consent to practically anything. Like once you're officially considered to be mentally ill, legally doesn't that mean you can't sign on to serious things? Is that not right? So is this not a contradiction?
Yeah, so I'm not an expert in the law around consent and capacity, but my understanding based off of the cases that I've reviewed, that I studied, as well as based off of my own personal experience, is that there are there are certain decisions that courts have said, you know, a person's mental health issue compromises their ability to make this decision. For example, there was a case where a woman had a very severe eating disorder, and they concluded that the nature of her condition prevented her from actually making a informed decision about whether to get treatment. And so they forced her to get treatment because of her health condition, her mental illness. The reality, though, is that people who have mental health issues, you know, we still do our banking, we still go, you know, if we go to the hospital, if we have a flu, or if we need some type of other treatment not related to our mental health, we still have capacity. And so it actually, you know, in this case, unfortunately, people who have mental health issues will be able to make these decisions. And that's deeply concerning because, you know, their mental health issue doesn't incapacitate them, but it does change and alter the way that they're going to make decisions. And what I mean is this: when you are struggling with your mental health, your survival instinct is sabotaged. You're no longer oriented towards continued life and existence and thriving. You're now, depending on what condition you have, you're now, you know, you're focused on maybe ending that suffering, or you're focused on isolating yourself because you feel misunderstood, or the decisions that you would normally make, that you as a human would normally make, have been altered by nature of the condition you have. And so, of course, you know, having had a mental illness, I'm thankful I was able to continue making choices. The issue is that many of those choices were harmful to me. And so even though legally I was allowed to make them, there is now this very serious question we have to ask of if someone is going to potentially make decisions that will harm them. And we already know this. People with depression, people who, you know, engage in addictions, they, you know, they're self-harm, they're making these decisions for themselves, and they're capable of making them, but those decisions are harmful and detrimental to their well-being. So why would we offer someone in that position access to guaranteed death? Why would we do that? And why would we think that that's okay to ever, you know, more or less give someone the means that they need to take their own life and say, oh, but it's up to you? Really, as a society, it's never our place to give someone a proverbial loaded gun. It's never our place to, you know, push someone off the proverbial edge. That's never what we're allowed to do. The law says that, you know, really, the law says it is always wrong for another person to take a human life, but for very exceptional cases like self-defense. And so the whole euthanasia-assisted suicide regime, unfortunately, has given the ability to nurses and doctors to say, you know what, unlike other Canadians, you actually can take a human life. And so I think that's really concerning. It's regardless of what the individual might choose, you know, there might be people, unfortunately, who do decide to take their own life through suicide. That's always tragic, but it does happen. People make choices. But it is never our place as society to give the person the method and the information and essentially help them do it themselves. That's not our role.
Isn't counseling suicide an actual crime in Canada?
Yeah, so it is absolutely a crime in Canada. The MAID framework, or medical assistance in dying, so the euthanasia-assisted framework, is an exception to that. And so basically what it says is it's wrong to counsel someone to commit suicide, you know, in all cases, unless you're a doctor or a nurse and the person has a grievous and irremediable medical condition. So, but this is deeply concerning because how are we going to enforce that law and protect vulnerable people if now every time someone kind of expresses an interest to die, or a doctor tells someone that maybe they should kill themselves, we call that medical assistance in dying, we call that healthcare. It's hard to know how we're going to actually be able to continue prosecuting people for counseling people to commit suicide, which is an awful, extremely problematic thing to do that should be prosecuted. How are we going to be able to distinguish that from medical assistance in dying? It's hard to know, and I think it raises the question of whether we've given doctors and nurses kind of an exemption from this criminal code prohibition. when really, we know that doctors and nurses are just like every other individual. Yes, they're trained, but they have their own biases. They have their own, their own perceptions about whose life is valuable and whose isn't. And the reality is that there have been cases historically where medical professionals have abused the authority we've given them. So do we really want to give them the ability to assist, to take a human life? I would suggest not.
Last question. We saw during COVID that doctors and nurses and medical professionals in general faced extremely serious consequences to themselves and their careers if they did not encourage people to take the mRNA vaccines. So it leads one to suspect that perhaps the same kind of pressure could be put onto medical professionals to encourage or advise MAID under certain conditions. Do you see that as being a possibility?
Yeah, so we already know that there are doctors who are not comfortable providing euthanasia-assisted suicide. And I should say, some of those people will not be comfortable maybe for religious reasons, but many of them are not comfortable for professional reasons because they are doctors, because they are trained. They are not comfortable providing harm and death. They want to provide health and care. And so there are already doctors who are not comfortable with this, and they unfortunately have been ostracized. There are, depending on the province you live in Canada, it can be difficult to actually live out your profession in a way that aligns with your conscience. Many doctors are being forced to provide what we call effective referrals, where they basically have to ensure that the person gets access to euthanasia-assisted suicide by handing them over to a doctor who will provide that, which for many people is the same as facilitating the death. They're still participating. So we know that this is already happening. And I think there's now even a more disturbing phenomenon where individual doctors, especially in some of these more extreme cases, like mental illness is present, maybe the diagnosis isn't quite as, it's not clear if the person's death is irremediable. There are doctors now who, if they, in their professional medical opinion, having evaluated the person, they say that that person does not meet the eligibility criteria, they do not qualify, that is now being treated as a conscientious objection. That's not a conscientious objection, that is a professional medical opinion. And so, but those doctors are being told that they need to refer that person, even though in their medical expertise they say that this person does not meet the criteria, they do not qualify. And so it raises the question about whether we've essentially required doctors to go along with it or hand them off to someone who will go along with it. It really raises deep questions as to what is the role of a doctor's medical expertise if we're not actually listening to them when they say that this is harmful, when they say we cannot continue. And frankly, the whole discussion around mental health is another one. Why are we not listening to doctors who are saying we cannot determine irremediability? It's not possible right now. We can't do it safely. So on the one hand, this started as a medical issue, as this idea of expanding treatment and trusting doctors to do this, but now increasingly we're restricting the doctors who are raising some serious concerns about this, and I think that is a problem.
Thank you so much on behalf of Rare Foundation USA. That was wonderful. Thank you for taking this extra time.
Thank you so much. Thank you.